Welcome to Healthy Minds. I'm Dr. Jeff Borenstein. Everyone is touched by psychiatric conditions, either themselves or a loved one. Do not suffer in silence. With help, there is hope. Today on Healthy Minds.
The COVID-19 pandemic has created all sorts of challenges for everyone throughout the United States, and that has had a profound impact on mental health and actually mental health care. About 50% of Americans have experienced at one point in time an increase in depression or anxiety symptoms, that the rates of visits to emergency rooms for adolescent boys and especially adolescent girls has increased dramatically through the pandemic. And we know that there are some communities in the United States that were affected more severely from a mental health perspective than others.
That's today on Healthy Minds. Welcome to Healthy Minds. I'm Dr. Jeff Borenstein. Today I speak with Dr. Josh Gordon, the director of the National Institute of Mental Health. Josh, thank you for joining us today.
Thanks for having me, Jeff.
I'd like you to share with us, what exactly does the National Institute of Mental Health do? Tell us about the Institute.
The National Institute of Mental Health is the principal federal agency in the United States that funds research into mental illness. Our mission is to conduct basic and clinical research to improve the understanding and treatment of mental illnesses. And we do that with the aim of discovering cures and preventative efforts to be able to reduce the burden of mental illness for everybody.
During the period of COVID, I'd like to speak a little bit about what you found in your position as director of NIMH, how it relates to COVID.
The COVID-19 pandemic has created all sorts of challenges for everyone throughout the United States, and that has had a profound impact on mental health and actually mental health care. We know, for example, that about 50% of Americans have experienced at one point in time an increase in depression or anxiety symptoms. We know that the rates of visits to emergency rooms for adolescent boys and especially adolescent girls has increased dramatically through the pandemic. We know that the burden of healthcare for mental health care providers has shifted from in-person to telehealth, creating a whole new way of providing that care. And we know that there are some communities in the United States that were affected more severely from a mental health perspective than others. Communities of first responders, communities of minoritized individuals, communities, low socioeconomic status, Native American communities. These communities were hit hardest by the pandemic directly, but also suffered the greatest mental health effects.
You mentioned a number of important aspects, one of which is the use of telemedicine, telepsychiatry. I'd like you to speak a little bit about that and how it's really helped in terms of dealing with some of the challenges that the pandemic has brought about.
The good news with regard to telehealth and telepsychiatry in particular is that we've been laying the groundwork that enabled that shift that had to occur during COVID through really years, decades of research. NIMH-funded research funded by other organizations, has shown that you can effectively deliver mental health care interventions remotely, over the telephone, through video connections, if you do it right. Unfortunately, when the pandemic occurred and many, if not most, physicians and mental health providers had to switch to virtual visits, we had shown that that could work. And they were able to pivot quickly thanks to advanced technology. And in fact, if you look at certain indices of mental health care delivery, the shift to telehealth resulted in increased delivery of evidence-based mental health care. Just one quick example. In federally funded healthcare centers in the state of California, the number of behavioral healthcare visits actually rose as the pandemic shut down in-person services because more people were able to make their appointments, more people were able to come and see a mental health care provider. So telemental health has really helped not just weather the storm of the pandemic, but if anything, to increase access for those who need it.